Hello, this is Dr. Jazz Ayuri. Everybody knows me as Dr. Jazz. Today I wanted to answer another question that we get a lot, and actually it's a very important question. And that question is, what is the difference between a plastic surgeon and a cosmetic surgeon? And now we just opened a big can of worms. So, so the field of plastic surgery, or the specialty of plastic surgery, is recognized by the American accreditation for graduate medical education. So that means that our programs have to be reviewed, the residency programs have to be reviewed by an independent organization every few years, and if there are some issues, they will go on probation. If the program doesn't meet a certain quality level, then the program will be shut down. And the board of plastic surgery, the American Board of Plastic Surgery, as a result, then also is recognized by the same organization. And to become a plastic surgeon, you have to train as a surgeon. The most common pathway is general surgery, but you can be a urologist, a neurosurgeon, an ophthalmologist, a head and neck surgeon, and then after you completed those training, you can then apply for a plastic surgery program and complete that. So I would say the quality control, or the level, the starting level, is more even. The American Academy of Cosmetic Surgery, from the information that I could gather at least, was developed in 1979 by a head and neck surgeon and a plastic surgeon. They do have, these, well, they call it, the residency, but it's really a proctorship, a mentorship. But you can be a dermatologist, you can be a family practice, an internist, or completed a surgical residency and then go and do this year or two of training and come out. So as you can see, that the starting level is all over the place. You can go from a non-surgical, training background and do this year or two of training. Because they are not accredited by the Graduate Medical Education organization, basically the academy is proctoring itself and policing itself and making sure that they meet a certain quality level. I'm not saying that's good or bad, it's just keep that in mind. There's not an outside independent organization monitoring these residency programs. So I would say overall, a plastic surgeon is going to have a higher chance of having a better quality training than a cosmetic surgeon. The other thing that I've noticed is cosmetic surgeons in general tend to be more, what's the word I would say, maybe cowboyish in their approach to some things. So for example, medical grade silicone can be used as a filler. This is not the caulking silicone that you hear about. This is actually medical grade silicone. It's sterile and it's high quality. And a lot of cosmetic surgeons are using it, especially in the lips, for fillers. But our society is very cautious because sometimes these fillers form granulomas and become very lumpy, bumpy, and they can be palpable and visible. And the only way to get rid of them is to cut the lip open and take this out, which will leave scarring in there. So I would say most plastic surgeons don't use them, and so we have a more cautious approach towards things. We take our time, and I think overall that's probably better. The third issue is that if there is, depending on the initial training of a cosmetic surgeon, so let's say for example somebody who did a dermatology residency becomes a cosmetic surgeon and does a tummy tuck, and the patient ends up with a big wound. The wound opens up for whatever reason, and they end up in the hospital and need, dressing changes or more surgery. Almost all the time they are going to contact a plastic surgeon because they're not trained in reconstructive surgery. As a plastic surgeon, we're trained in both cosmetic and reconstructive surgery. So now there's another surgeon involved. There may be more cost to you, So, keep that in mind. Now, having said all of this, this idea of, some plastic surgeons bad-mouthing cosmetic surgeons or cosmetic surgeons bad-mouthing plastic surgeons, well, that's just childish and unprofessional. There are some very good cosmetic surgeons out there, and there are some very bad plastic surgeons out there. If you remember the plastic surgeon, he was a plastic surgeon trained at a very good program who operated on Kanye West's mom. He just was not safe. And he was not board certified, and so I will talk about board certification in another video about that. But nowadays with the internet, there's really no excuse for any patient not to do their homework. So you look up your doctor, go to the medical board of your state and look them up. Make sure you feel comfortable with them. Look at their before and after photos, and hopefully make sure they're board certified. So I hope this information was helpful to you. If you have any more questions, please visit our website, www.drjaz.com, drjaz.com. Thank you.